visits. So I don't know who wants to go first on that. I took some notes down, but you all can also speak to that.
So speaking specifically for our Wilmot sites, can you hear me, Sandy?
I can.
Okay, good. So we are following a universal masking procedure. So all of our staff wear masks at all times, and our patients also wear a mask. So we feel that if both of us are masked, our exposure is very limited, and almost we actually consider a non-exposure if we're both wearing masks. You may also see if you come into our offices that staff may have goggles on or a face shield, and at times may also be wearing a gown, and that is to protect our patients as well as ourselves. We have a variety of hand sanitizers throughout all of our locations. Obviously soap and water in our bathrooms to make sure that we can keep our hands sanitized, as well as in our exam rooms and throughout our infusion centers. We have spaced out our waiting rooms so that if people do have to wait within our center, that you do not have to sit right on top of each other. You should be able to space out in any of our locations. And we are doing our best to keep our clinics on time and all of our appointments on time, so that waiting in any area should be very limited. At most of our locations as well, we have moved toward a no visitor policy. And while that is very hard for our patients as well as for us, we have found that it reduces the amount of people coming into our facility, which keeps all of our patients safe. We do worry about our cancer patients very often, worrying that we don't want them to be exposed to anything. And then it also protects our staff as well. We want to make sure that we can keep up the amount of staff that we have here at any given day to be able to care for our patients the way that they need us to. Linda, what did I leave out?
I think you've covered just about everything, and that almost covers number 3 that says the question is, can I bring my family, and what would a visit look like? So things change. It seems like sometimes things are changing every day, or at least every week. But although you're not bringing in a family member, we let you bring your phone, and you can have your family member on the phone during the meeting. Doctors and nurse practitioners are happy to call your family member before or after the meeting, whatever. We try to accommodate everybody.
And I just want to add too that you may see in our center screeners as you first enter the center, who might ask you questions or take your temperature and then direct you appropriately based on the results of that screening. And our cleaning crew or environmental services have really stepped up to the plate and are vigilant about cleaning repeatedly high-touch surfaces and clinic rooms, and really working hard to make sure that everybody stays safe. Our staff has also taken steps to distance themselves in workrooms and during their breaks, and really limit their contact in close proximity to each other. We also have in some of our sites iPads available for patients to use to communicate with their family, or pagers for their family to use if they are having to wait out in the car to pick them up. So, and I think there's also been some talk about and some efforts to decrease the waiting times that people have to spend in our waiting areas. And we can talk a little bit more about that at another question that comes up. I think, and then also the hospital has become very proactive in testing all patients who are admitted to the hospital, and that includes our patients who come in for elective chemotherapy admissions. They're tested prior to their admission to make sure that it's safe for them to receive their inpatient treatment, and also for them, to be appropriately cared for in the hospital. So the second question, is what are your tips for managing anxiety in patients and their families during this very uncertain time? So uncertainty really is the word. Everything has changed. You know, everything that you knew, being with your family, attending your support groups, your work, your travel plans, our, you know, finances, connecting with friends, doing whatever brought you enjoyment before, whether it was going out to movies or the theater or whatever that looked like. It's all changed, and it's changed for everyone. And it's particularly challenging during this time if you're someone who lives alone. So, you know, first of all, I think to just acknowledge that's very normal to feel anxious during this time. And to, you know, be okay with that, that recognize that it is normal, but it's how we react to that anxiety and what do we do with that. I think the other part of why this period of uncertainty is so big is because it's a global issue. It's happening to everyone, everywhere. And that can really have us feed off each other's anxieties. And it feels like it caught us unprepared, much like your cancer diagnosis probably felt. You know, we didn't expect it, we couldn't prepare for it, and that kind of rocks our boat a little bit. Additionally, the people that you might normally turn to during your own cancer experience, they're dealing with their own anxiety or issues related to this. So they may not be as present or as able to support you in ways that they had previously. I think that, you know, while we're all struggling to make sense of this, it didn't take away our other issues that might have been going on in our life, you know. So our normal stressors, it might exacerbate that, or even, you know, make new ones in terms of financial burdens. When you have a diagnosis of cancer, you have to learn to adapt with living with uncertainty. And so some of you may already have some skills that you used going through your cancer experience that you might be able to draw on, some things that helped you during those times of uncertainty or even your current experience with your cancer. So it's important to think about that. It's important to think about things you can control. You know, your vigilance to your health or your safety, you know, focus on things you can control. I think it's important to check in with ourselves every day, you know, not only physically, you're hearing that all the time, right? To be vigilant about how you're feeling or if you have a temperature or any symptoms, but it's also important to check in with ourselves emotionally every day. How am I feeling today? What am I experiencing emotionally? And then, you know, to acknowledge it, but not ruminate on it. Don't get stuck on it, but just acknowledge that it's okay. And don't deny it. Those feelings are real. It's just figuring out how you're going to respond to them. So some ideas are, one, recognize you're already living through this. We've had, what, 10, 11 weeks of this? You've already been dealing with this, and so you can do it. And it's easy to get sucked in or wrapped up in all the news briefings and the media coverage, but it's okay to take a break from that because things aren't changing that rapidly. So, you know, I even myself had to like say, okay, time out. I don't need to watch, you know, this news conference every single day. I'll catch the highlights later. Many of you have already had your medical appointments changed, so you know how that looks differently, but you also need to be reminded that your team is still there for you. It may not look the same. It might be like we're talking to you today in some cases, but they are still there for you. And even if you're not leaving your house, I know many of us are sheltering in place still, it's important to have a routine. You know, get up at the same time, take a shower, you know, go to bed at the same time, have regular meals. That kind of sense of routine helps us feel a little bit more in control. And of course, doing activities that entertain you, that you are able to do in your current situation, talk on the phone, use the internet to connect with people like we're doing today. One patient told me that they schedule a time to eat with their friends over Zoom, and they might all be having the same thing, or they might do different things, but it's just a way to keep social because eating is such a social thing. You know, of course you see on the news all those things about this is a good time to catch up on all those projects you want to do at home, clean your closets, put your photos in albums, things like that. I can tell you, despite having all this spare time, I'm finding lots of reasons why I don't want to clean my closets right now. It's important to still try to get outside if you can, if the weather is conducive to that. And also to, you know, get out in the sunshine. That sunshine's so important to our mood. And exercise is a good stress reliever. And so is humor, trying to find ways in your day that you can, you know, look at something funny or laugh about something. But wait, I have more. There's the, you know, I think the sponsoring organization for Gildas Club, the Cancer Support Community, they have a series that they're doing, and you can access it online, called Frankly Speaking About Cancer. They do that all the time, but they have a spotlight on coronavirus. And one of them is actually entitled Coping with Emotions. So that would be a good one if you just wanted to choose one, and that was something you were curious about, would be a good one to tune into. And of course, Gildas Club has put a lot of their programs together virtually. And so that's a good way to still connect with people and be involved. At Wilmot, we've also converted a lot of our groups to virtual support groups. And that has been really interesting for us. We've really appreciated connecting with folks that way. And it's made us think that maybe going in the future, we can still do this in some fashion, because some of our participants who live far away, who can't drive in for a group, are joining us electronically. So we may, you know, continue with a practice like that. Likewise, our Integrative Oncology and Wellness Center also has a lot of their programs available virtually, and those are all free. So, you know, that might be something to check out. And then I think just focusing on the good things in our life, you know, like focusing on gratitude, not on negativity. So like maybe writing down at the end of each day something good that happened that day, or a couple good things that happened, or focusing on being grateful, or saying thank you to people, or sending a thank you text to someone that you talk to. And of course, mindfulness is always important, to try to bring ourselves back in the moment when we're going off to the Milky Way, wondering what it's going to be like 2 weeks from now, 6 weeks from now, a year from now. Let's just bring ourselves back to the moment. And there are a lot of apps that can help you do that if that's something you're interested in. I know they have a list of those on our Integrative Oncology website. There's a link to those. And finally, if you're having a difficult time emotionally, it's okay to ask for help. I know it's not always easy because we're so used to being in control and being in the driver's seat, and we don't want to ask for help. But it's important. Your emotional health is just as important as your physical health. And so it's okay to ask your social worker, your PCP, your oncologist, ask someone because there is help available, and we can link you with someone. You don't have to have online or in-person appointments. They could be in this fashion. They could be over the phone. There are even hotlines available. So I'm gonna say the next question, and then I'm gonna let the dog out because you can probably hear her. She doesn't want to be in here working with me anymore. What does a normal patient visit look like right now at Wilmot, and can I bring my family?
So we touched on the can I bring my family. So for the most part, the answer is no, but that we've been creative in allowing people to FaceTime during their visits, make a phone call and be on speakerphone. We have more than just inpatient visits available. Sometimes having an inpatient or in-person visit is necessary. However, we've found that we can use telemedicine. So you might get a notification from your office to say your provider would like to do a video visit with you. And currently we're using Zoom. And that's actually a great way that our team can see you. A lot of times we feel it's very important to see you. So if you have concerns about using the technology, please let us know, because we have resources to be able to help you work through them and be comfortable with it. Because we can gain so much just by visualizing a person and seeing, do they look well? Are they dressed for the day? Not that you have to be dressed, you can be comfortable, but things that may be concerning for us. Also, if that isn't a resource that you can use, we can do telephone visits as well. And a lot of times at the Zoom meeting, sorry, my phone's ringing, it'll stop shortly. A lot of times in the Zoom meeting also, if you want several family members involved or a friend involved, there is a way that you can have multiple people in your visit with you. So if you didn't want to, if you want people to be able to provide input to how you're doing, we've seen multiple people in the visits with us, and your whole team can be involved in the visit too. So not just your oncologist, but also the nurse practitioner, physician assistant who works with you may be involved, or a social worker may be involved, and the clinic nurse. So we can have a variety of people who can participate in your visit with you.
There's always something good that comes out of trials and tribulations. And one thing that we found is the Zoom meetings have a place in the future for our clinics. So in the future, if you live far away, or if you can't physically get in, but you have a question or you have something you want the doctor to see, we're going to be able to work through this so that our provider can call you and you can link on Zoom. It won't be an everyday kind of thing, but it'll be something that'll be useful. So again, something good came out of all of this. What's our next question?
All right. What is the current status of clinical trials being offered at Wilmot? So, I mean, I can start and you guys can certainly weigh in. I don't have a lot on this, but those who were already in clinical trials when COVID started, they stayed on their trial. But they did temporarily have to pause enrollment in new clinical trials. But that has all opened up and all clinical trials are open again. And it also allowed them to do some good work behind the scenes with Helen Peck, the new director, right, of the clinical trials office, and her team got to really dig in and look at some of their behind the scenes operational procedures and really focus on those things. Do you guys have anything to add right now about that? Okay. And then as a follow-up, what advice do you give patients considering joining a clinical trial? So first of all, I tell patients, because I often hear them say that you are not a guinea pig if you're in a clinical trial. By the time a trial gets to this level of being able to be used in a setting like this, it's anticipated that the trial is most likely going to be the next standard of care or better than the current standard of care. And then to reassure people that there is an internal review board, an IRB, that carefully goes through every single clinical trial before it ever is offered to a patient, to make sure that it's safe, to make sure that everything looks right, that patients are protected, whatever that needs to happen with that. They certainly scrutinize all of those. The other thing I tell people is to ask questions about the trial. What does the trial cover and what's going to be required? So for example, some trials may require additional testing or additional scans or additional appointments. So it's important to know if those are going to be covered by the trial or if they have to be covered by your insurance. And if they're covered by your insurance, then it's always good to call the insurance and just tell them that you're enrolling in this trial and it's going to require this and will that be covered, just so that you're not surprised. And then also to remember that you can always disenroll out of a trial, you know, for whatever reason. So it's not something that you're locked into forever. So, and Linda and Alicia, I don't know if you have more to add about trials.
No, that's good advice.
Yeah,
Sandy.
that's good.
Yeah, and I also just want to say too that I think I can speak for myself and for Linda and Sandy that we have seen some really amazing patient stories that come out of clinical trials. People who are on clinical trials today could be what is our standard of care in the future. So really, we always say that if there's a clinical trial available for you that your oncologist is recommending, it's often probably the first choice for you because you can potentially be benefited more than what the standard of care is. We're always trying to find the next best thing. And like I said, I've seen some amazing stories come out of clinical trials, and you are incredibly well monitored to be sure that it's safe. As Sandy said, it's usually gone through many other stages of research prior to coming to our patients. So working out what is going to work, what is going to be safe for our patients, often has already been done well before it gets to our centers here for you.
And that also one reason why at Wilmot we're so happy to be able to have our access to clinical trials now for all of our patients who live further away. In the regional sites, they're able to also enroll in clinical trials and participate in them, and that might not have been available to those patients prior to our ability to be present down there. So does a history of cancer raise your risk of health complications from COVID-19?
I can jump in on this. So studies have shown, there aren't a lot of studies about this, but there's actually one small, very small study that was published in March that showed people that have a history of cancer do have a higher incidence of severe complications, but that does not mean that they have a higher incidence of contracting the virus. So if you have the same risk as anyone else, but if you have a history of cancer and you do contract the virus, you have a higher risk of very severe complications. But again, that was a very, very small study, but it's in a reputable journal. It's in the Lancet Oncology. I think as we move forward, we'll have a lot more data to look at and more information that we could, get more information from, useful information. But for now, I think that doing what the CDC recommends and, hand washing, keeping your distance, even while you're at home, there's a question on the side about, what can you do? What precautions should be taken by others who live in our households, siblings, parents, etc. The same thing that we're doing here. You wear a mask if you're in treatment and you're immunocompromised. Wash your hands a lot. Use a lot of hand sanitizer. Keep surfaces clean, and try to be distant, as close and distant as you can. It's hard to say that, and it's a whole new world we're living in. How about you guys?
And I think contacting your healthcare provider as soon as you aren't feeling well. I think sometimes our patients expect to not feel well, and maybe may wait to contact us because we think we're supposed to feel that way. And there's so much support that we can offer. And a lot of times if we evaluate you early on, we may be able to help sooner rather than later and prevent any complications. Right. So I think an answer always, if you have a question or you're mildly concerned about something, give us a call. We are more than happy to help work it out. We're more than happy to figure out if it's serious or not for you.
Karen, I'm just now realizing people are putting questions on the chat box. Do you want us to pause and answer those before moving on?
Yeah, that would be great. However you guys want to do it. That'd be
okay.
wonderful. Thank you.
But they are.
You have an idea when searches for matches? I don't know.
I don't.
I would contact your team for that. I think they're trying to move forward with that, but do it in a safe manner. So if you already have a provider that you're connected with, my advice for the matches and stem cell transplant procedures is to reach out to your team. They'll have the best information for you.
And then do you know if the ACS wig room is open? The last time I spoke to the people at the American Cancer Society, the building is closed. That includes Hope Lodge and the wig room. And so we have just been encouraging people to contact individuals directly to see if businesses that normally supply wigs are open. But there are still things available through that TLC catalog, and that's an ACS catalog. Sandra, did you say Wilmot has virtual support groups? We do. The caregiver group meets monthly, and that's virtual. The head and neck cancer support group is virtual now and meeting monthly. The melanoma group is coming up soon. They've been working on their first meeting date. So they are meeting virtually. I'm trying to think what else. Oh, the brain tumor support group has been doing some virtual meetings. So we are excited to be able to do that. And if you want information about those, any of our groups or any of our resources, really, we have a community resource line. I'm just looking up what the number is. It's 585-276-4708. So again, that's 276-4708. And that is answered by any member of my social work team during the day. And they can tell you about community resources, including the offerings that we have.
Just want to see if you guys saw it. We have one more new question that came in. How long after my treatment is complete am I still considered immunocompromised?
So it would depend on your specific treatment, and especially during this time, I would at least give yourself, I would say, at least a month to recover. But I would speak specifically with your team about that because it would depend on the treatment that you're receiving, but also the type of cancer that you may have. I think going forward, really, the best thing to do is to consider yourself always at risk. Like all of us are always at risk for contracting this. So the best thing is to wear your face covering when you are around people and can't socially distance, to stay socially distanced as best as possible. Hand washing is going to be your number one thing all the time. So keeping a little thing of hand sanitizer on you and always using it whenever you're touching surfaces, keeping frequently touched surfaces clean. I know we do that around our office constantly. We're all taking turns on our high touch surfaces, keeping them clean for everybody. So I think the things that you learn while you're going through treatment and while you're going through your cancer care are good things just to keep with you all along and to share with your friends and family so that you can keep yourself safe, you can keep others safe, you know, and just do whatever you can to prevent it from you getting it, but also from spreading it to others.
Yeah, I would say that our cancer survivors have a leg up right now in this time of crisis because they already know how to take good care of themselves.
Right, they do.
So that's a good thing. Okay, moving on. I am in the process of diagnosis and staging for cancer. What should I do? So I
would say you should probably continue with your plan with your provider and talk to them, be honest with them about any hesitation that you might have any questions that you have to have a good relationship with your team and let them know we're always here 24 hours a day. Call us up if you have a question, if you have a problem. Should you move forward, talk to your doctor. You're going to weigh the pros and the cons. Is waiting something that you should do? Would that benefit the potential risk of getting the virus, or should you move forward? I would say move forward in the discussion with your doctor, but always using hand sanitizer, washing your hands, don't touch your face, all the things that you already know.
I would agree with that. And goodness, now I'm at a lot of feedback. Also just weighing too the emotional impact of going forward versus not. And even if you were to hold off, what is that going to do to you emotionally, knowing that you may need to be moving forward with the cancer treatment? Is that going to compound your stress by waiting? So it's good discussions to have.
It is. And the other point in that is that sometimes people, friends, relatives might say, oh, you're moving forward with that? Maybe you shouldn't. Well, maybe you should talk to your doctor about that, because they're the ones with all the information and the better information. They can guide you in the right way. They're not going to do something that's going to hurt you.
Right. What should you do if you don't have health insurance due to losing a job during COVID, and how to proceed if you are receiving treatment? So, unfortunately, that is happening to people right now due to downsizing, furloughs, the current economic situation. So, we want you to reach out. We want you to reach out to your social worker or your team. If you don't know who your social worker is, we will partner with you to help you navigate what your options are and get you linked to the right people who can help you with that. We never, ever want someone to delay their care or their treatment based on finances or insurance issues. And so we feel very strongly that we want to know about it. The sooner the better. And we'll be able to help guide you with that. And also to keep in mind that many organizations, including Cancer Support Community, have created some extra sources of funding during this time. So your team or the social worker, they can link you with the social worker who can help you see what might be available and appropriate for you to apply for. This is kind of similar to a question we had. Does having received chemotherapy or radiation in the past raise your risk for getting COVID-19 or having a more serious course of illness? I think you touched on that already, Linda.
We did. Like I said, there's some evidence that patients with cancer could experience more serious infections, but generally you're not at more risk than anybody else. But if you do get it, you're at risk of having more serious complications. But that, again, is from a small study because everything is so new and it's such a long but short time period. So as we move forward, again, I think we'll have more information. But skipping a treatment because you're worried about getting the infection, that's a really serious decision that you really should talk to your doctor about.
Another question. Should cancer survivors follow the general public health recommendations issued by the CDC?
Yes.
Yes.
Absolutely. I think what a lot of people may not understand from the CDC and other organizations like that is they make decisions for the public based on our vulnerable populations. So what they recommend to all of us is really to protect our most vulnerable populations. And in cancer patients, cancer survivors, and other people who can potentially be immunocompromised based on what they have would fit into that, so that we would recommend that you are following those CDC guidelines as well as those family members that you may live with.
And again, follow the recommendations from your team as well, if they may have additional things to add to specifically for your situation. All right, if a cancer patient or cancer survivor feels some early symptoms, such as a fever or a cough, should they contact their medical oncologist or their primary care physician?
If you're in the midst of treatment, you should call your medical oncologist. Call your center, and again, 24 hours a day, there's someone there to help you. But if you're no longer receiving treatment, if you're weeks, months, years out, but still connected, you could start with your PCP.
And we've sort of touched on this one already, but if a person is about to start cancer therapy, should they consider postponing treatment due to COVID-19?
I think as Linda explained earlier, we would recommend that you talk with your team about it and lay out your concerns that you may have. I think what we're finding now, because we don't have a whole lot of information about COVID-19 in general, our oncologists and our nursing staff are very attuned to what is responsible and safe and weighing the risks and benefits. So it is a conversation, and I think it might be different for each person. So I think the basic information is to be open and honest with your team and together come up with a plan that is right for you.
And I can just share that there is a task force at Wilmot that started at the very beginning when all this started, and they meet regularly several times a week. And I'm privileged to be able to sit in on it. And I am always just so amazed at you know, their sharing of information, their networking with other oncologists throughout the country and the world, actually, of what other places are seeing and what they're doing and how they're responding to things. And also, you know, that the overarching theme of every decision that this committee makes is for patient safety. And so whenever there's a decision to be made, they use that as the guideline to help weigh what they're going to do, even, you know, with tough decisions like limiting visitors temporarily and things like that. So I think that was the end of our questions you had already given us, Karen. You said there were some other questions, though, that had come in.
I'm going back to the beginning here. I think you guys probably covered all of them that came in already. So all the new ones that we had from today and all of our attendees so far. But if anybody else has any other questions, feel free to type them into the Q&A box or the chat box, and we'll be happy to get those answered for you.
While we're waiting, did either of you have anything else you wanted to share?
One thing I will say, I know we've been talking specifically about Wilmot. We obviously have close colleagues over with Rochester Regional Health System too, and we seem to be pretty in line with what our recommendations are to patients, as well as what our staff are doing. So I think this is a really interesting time of real community collaboration, and even statewide and throughout the country too. I think, as Sandy was saying with the COVID response team, that we don't have all the information with us right now, and it's a very scary time for us and for our patients. And so really what we're trying to do is make decisions that really are at the heart of patient safety. So collaborating with colleagues at other centers and across the country and in other countries too, to see what worked, what didn't, what resulted in good patient outcomes, and what shouldn't we do. So it is a really interesting time to be a part of healthcare changes, and I think the biggest thing really is to, if you didn't feel comfortable reaching out before to your team with anything, know that we're here. We have nurses staffing our triage lines and can help answer questions for you and follow up with your providers. We're doing more, as we talked about earlier, with telemedicine. So if you aren't able to come into our centers, that's an option for you. If you want your family members involved in your telemedicine visits, that's absolutely an option as well. So we want you to feel safe where you are, but also we want to be here for you.
We have 2 more questions, guys. Will patients have access to antibody testing soon?
So I'm not sure if we have a decision on that yet. I think we're still trying to determine how good antibody testing is. Unfortunately, I think we don't know, and I don't think we know what it means. It potentially could mean that you're immune to it, but I think we don't have the answer on that yet. So I know some centers, maybe not through the hospital systems, but some labs are offering antibody testing that you can just go and do. But right now, that's not something consistent that we've been offering to patients just yet.
Thank you. What happens with treatment if you test positive for COVID-19, and what have you seen?
So this is something that went through that task force, and Linda, you can chime in too. So as Linda and I have been saying, as well as Sandy, it's a discussion with your team for sure, weighing the risks and benefits of that treatment. Do you still have symptoms? If you don't get your treatment, are you going to end up in the hospital? And that's a risk we don't want to take. So they have developed algorithms for us to determine kind of a best practice for us. Typically, we prefer the patients aren't having symptoms if they do need treatment, and also we are keeping things private too. So if you did test positive and you're within that certain window where we still have concerns and maybe haven't had a negative test yet, but you do need treatment, we can treat you in our locations. We'll do it in a private area. Your treating nurse will have a whole getup on, and that's to keep everybody safe too. So if you do need treatment, you absolutely do have options for that.
Okay, great. Thank you. We have one more question. Somebody had to join a little bit late, and you guys might have covered this. You did cover this a little bit already, but it's worth answering one more time, I think. So for patients receiving chemotherapy, what's the thought on them doing some of their own shopping, going to Wegmans or other stores like that?
I think it first depends on what type of chemotherapy, but if you are speaking generally, I would say at this point where we are, wearing a mask, keeping distance when you're in the store. I'm not sure you're supposed to go to a garden. Should you go there and, with the dirt? But although you could go and walk around, I guess. It made me pretty happy doing that over the weekend. But you could go and get your groceries, but just keep your distance. And Wegmans has a pretty good way of keeping everybody, a limited number of people in the store, and keeping you 6 feet apart. But again, washing your hands, wearing the mask, keeping your distance, don't touch your face.
And if it's not something you feel comfortable with and you don't have, supports or people who can help you, that's another thing to reach out.
Right.
Maybe there are some things we could link you with or set you up with that might help in that regard. So, but if it's something you want to do and you do it
Right.
safely, and then that's good too.
Great. Thank you so much. I don't think we have any other questions. You guys have any other parting words? Good. Well, I thank you. I thank you, Sandy, Alicia, and Linda for joining us today. This was really informative and very helpful, I think, for everybody that was on the call. So I really appreciate you guys taking time out of your day to join us. Claire, thank you so much for setting this up. And we hope to do something like this again in the future.
Thank you.
For having us.
Thanks, Karen.
Great. Thank you, guys. I hope everybody has a great day.
You too.
All right. Take care. Bye-bye.